Welcome to the Confident Smile Podcast, where we talk with the leading experts on how to treat dental issues and get healthy gums and a beautiful smile. With your host, Dr. William Levine, a periodontist of 35 years and chief scientist at Periactive, a trailblazer in oral care. Periactive is clinically proven to reduce inflammation and promote gum healing within 60 days.
Hi, welcome to the Confident Smile podcast again, and I appreciate all your listeners tuning in. And we have an extremely unusual and special guest today, Dr. Marc Lazare from New York. And Dr. Lazare practices a unique type of dentistry, which is very popular in medicine, but is really very new in the dental field. It's referred to as biomimetic dentistry, and frankly, I'm going to let him explain it to you. But a little bit about Dr. Lazare. He's a well-known speaker internationally. He's published a book about biomimetics and multiple articles, and he's really a leader in the field and in change. So, Dr. Lazare, first of all, welcome to the podcast. Thank you for joining us. And I think we can just start discussing things and seeing where we go.
Well, thanks so much. It's definitely an honor to be part of the Confident Smile, and I'm happy to be here with you. This is pretty exciting. I'm thrilled to share this groundbreaking realm of dentistry we call biomimetic dentistry. Basically, just to break it down, literally translated, biomimetic means to mimic the natural biology of the in dentistry, the tooth structure we're replacing. So we're trying to mimic the natural properties and characteristics of the tooth that's being restored or replaced. Basically, biomimetic dentistry is where art, science, and nature all converge. It is the most biological form of dentistry that's out there. And at its core, it inspires inspiration from the natural world, just as the Nautilus shell is designed to withstand the tumultuous currents and crashing waves and hold its form and have a certain beauty to it. Same with biomimetic dentistry. The tooth itself is made to withstand the pressures of clenching and chewing and grinding. And I always say that once you remove a certain portion of that tooth, like you're doing a filling in a tooth, it's like taking a top of a tin can and it can just be crushed and you lose that integrity and the strength. So we're trying to rebuild what's missing, mimicking the natural properties of what was there before to preserve that natural structure and the artistry of what was there. And that's biomimetic dentistry. We're trying to emulate nature's design. And it's really innovative. It's very, very different. A lot of people don't do this, but it's been catching fire and really capturing people's attention around the world. So I have been lecturing, lucky enough to lecture around the world on these principles. This has a lot of interest, a lot of, I've been seeing more and more people have been studying this and learning about biomedical dentistry, and there's some great gurus in the field who've been teaching different aspects. And I'm honored to be a part of this thing. I'm very active with the Academy of Biomedical Dentistry, where I've been president, and I've met some fantastic people around the world, a lot of like-minded people. And this is not your traditional dentistry. Traditional dentistry is very aggressive. It's very aggressive. Back in the day, doing a silver filling was considered conservative. And now I look at a silver filling as being highly aggressive. Because basically to do a silver filling, you're undercutting good tooth structure. If you have a small cavity, you're going down a certain depth, a certain width, and undercutting that tooth structure to physically retain what's there. And what happens is inevitably, after chewing and grinding, the tooth can crack and can break. And a lot of things happen once that goes on. And most people, unfortunately, are taught retentive dentistry. So, which means that they try to purposely prepare a restoration to retain, physically hold and retain that restoration, where we don't do that in biomedical dentistry. We rely instead on adhesive dentistry, where we don't take away to retain, we just add and bond. And we're trying to preserve. The goal of biomedical dentistry is to preserve the vitality of the nerve at all costs, to avoid root canals and to preserve the integrity of the tooth structure and avoid taking away any unnecessary tooth structure. That's the goal, to avoid root canals, to avoid crowns, to avoid anything invasive, and to preserve what you have for as long as you have it.
It's a fantastic idea. Let's sort of break this down for the patient. A patient comes into your office,
Yeah.
and as you said earlier, in the past, what they would do is basically the healthy tooth structure served to hold the filling in place, which was sealing off the old decay. But you're advocating a completely new approach where you're going to use and bond the rest of the healthy tooth structure back to itself in a sense. So, okay, a patient walks in the office with a big cavity, maybe borderline root canal if he's unlucky. And if he would go into a standard dental office, he would definitely get a root canal and a big filling, if not a crown. But he walks into Dr. Marc Lazare's office. What happens?
Okay. So basically, this happens all the time to me. So a patient comes in and they have a very deep cavity, and the cavity is so close to the nerve. And most dentists out there are taught, if the decay is very deep and very close to the nerve, do the root canal. And then if you do the root canal, well, you should definitely stick a post in the tooth to help, retain the crown, and then cut away the good tooth structure to have a crown. So they teach you in dental school, it's cookie cutter dentistry. They teach you in dental school and residency programs, you have deep decay, do a root canal, you do a root canal, you do a post, and you do a crown. And now this tooth, which may have been able to avoid all of that, you could avoid the root canal and avoid the post and avoid the crown just by doing very conservative dentistry. I've referred out 80% fewer root canals in my practice since I've been doing Biomimetic Dentistry. So basically, my criteria is this. If someone comes in with deep decay, I say, are you in any discomfort? If there's no discomfort, I'm testing to see if there is any vitality to the nerve. If the nerve is vital and having a normal response, why do root canal? If I take an x-ray and there's no infection on the x-ray, why do root canal? So if there's no pain, no infection, and the nerve is vital, why do a root canal? To me, it's a crime to do a root canal on a tooth that is vital and healthy. So I wouldn't do it. And we have techniques in Biomimetic Dentistry to remove all of the decay around that area without exposing to the nerve, and that protects the nerve, and you seal it up, and then you rebuild around there. And what's interesting is that almost most dental schools will teach that if you do a root canal, you do a crown. I can't wrap my head around that. Why is it so cookie cutter where you do a root canal, you do a crown? It should not be that way. Not every tooth that has a root canal needs a crown. In fact, a lot of them don't. So to me, I've maybe created about 10 new crowns in the past dozen years. I mean, there's no reason to cut down good, healthy tooth structure because you want to preserve that good, healthy tooth structure. If you have a tooth that has a big cavity in the center and all you have is good walls around it, why cut down those good walls around it to create a crown? Because when that fails, and it will fail inevitably, it's going to be a catastrophic failure and take everything with it. So basically, in my practice, what I do is if we can avoid root canal, we avoid it. Sometimes you have to do root canal because it's infected. So if it is infected, you do root canal. And then from there, you just still preserve all the good tooth structure and you build back what's missing with the techniques and protocols of Biomimetic Dentistry. There are certain materials that we use in Biomimetic Dentistry that's very different than other areas of dentistry. For example, we use materials that mimic the natural properties of dentin, that the tooth structure that's a little more elastic under the enamel. We use a material that mimics those properties to build back the dentin. We use a material that's harder to build back the enamel. And when we have thin walls or cracked walls or missing areas, we will scaffold the whole inner aspects with this polyethylene fiber mesh that basically mimics the natural dentin enamel junction, and it preserves that integrity. It's like an onion layer of inner scaffolding that just protects the tooth and absorbs the stresses of chewing.
So you're not only reduction of healthy tooth structure, you're also helping minimize root canals. You're helping minimize posts which may not be necessary. You're really revolutionizing the traditional approaches, which I know is not easy. So give you hats off on that one.
Yeah, I haven't done
The
a post. I haven't done one post in the past dozen years. In the past 12 years, I haven't done one post. I've referred 80% root canals, and I've only done about 10 new crowns, and those were only because there were cracks and certain reasons to do that. Otherwise, I've preserved all tooth structure.
So let me try to change lanes slightly. And I know you spend a lot of time working with people on improving their smile and their aesthetics. We both know that laminates have become extremely popular as if it's a less invasive technique. But we both know that it's somewhat invasive. So patient A comes into your office and says, I'm not happy with my smile. How does Dr. Lazare look at this with the principles of biomimetic dentistry, and what can you do for that kind of patient?
Well, before I started lecturing on biomimetic dentistry, I was lecturing on smile design and then doing a lot of smile makeovers. That was my passion before biomimetic dentistry. Now I've kind of combined my two passions of smile makeovers and biomimetic dentistry, and I coined the phrase the biomimetic smile makeover, because you can do a full smile makeover in a lot more conservative manner, preserving a lot more tooth structure. I just did a great smile makeover. I published an article on it where I basically redid every single tooth in his mouth, but only one of them was a crown. And that was only because it replaced an old crown. Everything else was not a crown. So you do it with overlays, with veneers, with materials that are more biomimetic. So if you're replacing old fillings in the smile makeover, you build back what's missing in the most natural, biomimetic way with the same biomimetic principles and protocols and techniques and materials. Once you're doing the aesthetic material, again, you would want to be conservative. I redid someone's veneers on top, but there's a lot of empty space. So instead of crowning it to fill the space on the inside, I rebuilt the whole inside with bonding, and then did the more conservative veneers on the outside. So it was less tooth structure that had to be removed. It's basically when you're doing smile design, you take records to see where the person wants to go to and what they need to do to get there. Not every smile makeover needs to be aggressive, but some need to be more aggressive. For example, if you have your tooth in the teeth are in the perfect position, let's say your teeth are in the exact perfect position, but you have tetracycline stain, you have discoloration, you just want to improve your smile with a better looking shade. You need to relieve about 1 millimeter, let's say, of tooth structure to add back that millimeter of tooth structure in the ceramic. And if you have one tooth, for example, that's sticking forward 1 millimeter, then you'd have to relieve 2 millimeters to add back 1 millimeter. But if your tooth is already smaller and inset, why take away any tooth structure? Just add to it. So it really depends on the position you're in. I think it would be hypocritical to say we could do all smile makeovers without taking away any tooth structure. I think that's a false claim, because it really depends on the position your teeth are in and the shade you're starting from and the shade you're trying to get to, because you have to have a certain amount of thickness to layer the ceramic to create a natural, beautiful appearance. But even that in mind, I may elect to add certain aspects of those teeth back in bonding rather than cut away more to just wrap around ceramic, because that's easier. I might take a harder approach to be more conservative with the tooth structure, then just make it easier for me and the ceramists to do what they have to do and take away more tooth structure. So you can achieve the same end beautiful natural results being more conservative.
Very nice. Let me ask you something though, and maybe these materials that you've alluded to that you use that are sort of unique are available to the general dentist.
Yes.
Why do you think that more people are not doing this type of work?
That's pretty easy. Basically, because when a rep comes into my office and says, "I have a new material you have to use. It's cheaper, it's easier, it's faster." They use the buzzwords to get the dentist to use it, because dentists, time is money. You're trying to move faster, so they'll use something that is quicker. For a lot of dentists, they don't want to have to think or do something that's so technique sensitive, so they use something that's easier. And of course, if you could save some steps and do a one step instead of a multiple step, that's what people tend to gravitate towards, because it's easier and it's used less of your mind to do it. Unfortunately, these shortcuts And these cheaper materials are not the gold standard materials that will have the longevity of what we're looking for. So in my practice, someone comes in saying this is cheaper, easier, and faster. I say, show me the studies. Show me where this is better than what I am using. Show me the longevity. If they can't show me something that is better than what I'm using, which I not only use the gold standard of materials, I'm not going to use their stuff. I don't care about faster. I don't care about cheaper. I think the patient would agree they'd rather pay the little tiny bit extra to have the better material, that they would rather spend a little extra time there to have something that's going to last them longer. So the materials that we use in biomedical dentistry are the absolute gold standard, and the gold standard because every single peer review dental article shows they're the gold standard time and time again. And so we basically in biomedical dentistry use one of two materials, in our practice. We're using a material called OptiBond FL by Kerr and a material called SE Protect by Carrari. So if it's not one of those two materials, I'm not interested unless they could prove that the materials they're showing are better than those two.
So you sort of touched on an interesting point, and I apologize if I say anything that's untoward, but you have a beautiful practice in Manhattan, New York, and it's clearly a high-end practice. And I know you give all your being to your patients and all your training and skill sets. But in the periphery, some of the smaller towns, not in the center of New York City, the dentists may not have the skill sets, and maybe the population doesn't have the finances to handle that. So how would we be able to apply the biomimetic principles in those type of areas?
Well, a skill set is just education. I mean, the dentist has to take the necessary courses and practice. And once they learn some of these techniques, it's really hard to go back to what you were taught if you know this. Like I try to give the benefit of the doubt and say, well, if the dentist is doing this type of work, let's give benefit of the doubt that that's the best they could do with the knowledge they have. But once you have a different level of knowledge and you can understand that this will destroy the tooth ultimately, this will kill the nerve, this is unnecessary preparation, this you don't have to do the preparation on retention, do it with adhesive technology. Once you know these basic things, you can't go back. And if you went back, then is it ethical to go back if you know what you know now? So the dentist should be able to take the courses, learn things, and apply things, even if they can't apply every aspect, or they can't do everything that we're advocating. At least they could add some of those things to do it, which will help their patients. As far as people being able to afford it, I think once patients are educated on these on what's available, they would choose to do the biomimetic approach, because the biomimetic dentistry is actually a lot less expensive than traditional dentistry, a lot less expensive. A lot less. So for example, if someone came to me with that deep cavity that we described, and the average dentist in anywhere in the world would say, oh, this is a deep cavity, we need to do root canal. Well, let's use some New York prices, for example. I mean, if a root canal is $3,000 and a post is another several $100s, post and core, and the crown is another few $1,000s, you just spent about $7,000 on a tooth. And if they need a crown lengthening, it's because the cavity went down deeper, another couple $1,000s. You can spend $10,000 on a tooth, and you're cutting away all the good tooth structure and compromising the tooth. And it's multiple visits with multiple specialties. And then in the end, that tooth is so weak, it's going to break. And those dentists will say, okay, so what? Let's extract it, put you through the extraction and the bone graft, and then put you through the price of the implant, and put you through the price of another crown. And you spend $15,000, $20,000 on one tooth. It's ludicrous. So when someone comes to me and says, can you help me? And I say, well, it might be a couple $1,000s to reconstruct that tooth biomedically. I'm saving them thousands upon thousands of dollars and all those visits, because I could do it in one visit. So, and I'm taking away zero tooth structure. So if I'm saving the patient time, I'm saving the patient money, and I'm saving the patient tooth structure. So how can you not do it? It's very, and people don't understand insurance either, because insurance, people say, well, does my insurance cover it? No, but biomedical dentistry is not necessarily recognized by most insurance companies. They're very old school. But does it matter? Because most insurance companies have a maximum anyway. They'll cap you at $1,000 or $1,500. $2,000 is a great plan. So if you have a $1,500 plan, which the average person does, Then after 2 cleanings and some x-rays, you have like $500 left. So if they'll cover $500 toward a filling, everything else is out of pocket anyway. So what does it matter if they'll cover half of a crown or half of a root canal or 80% of this or 80% of that? It makes no difference because it's going to be out of pocket once you've already gotten to that level. So you'll be saving a lot of money by doing biomimetic dentistry. And if you're looking at other places in the world, like for example, I lectured in Manila. And in Manila, it's very, very interesting because the most expensive procedure that's done in Manila is a crown. And that's how they make some of their money, but it's $300 for a high-end crown in Manila. The average dental procedure is like $10 for a filling out there. So if you're doing a crown, half of it, $150 will go to the lab fee. So you're now making $150. It takes 3 hours to do, 2 hours to prepare the crown and make the temporary and take the impressions, 1 hour a couple weeks later to insert it. And so 3 hours of time for $150, you're making $50 an hour. Now, if you said to your patient, you have a choice. This is what every dentist should say. You have a choice. If you have a choice and you say, well, we can either cut down your good tooth structure and prepare a crown and charge you $300 to do that, and it takes you 2 visits, you got to come back twice to do this. Or I could save all your good tooth structure, reconstruct what's there, and not take away any tooth structure and have it just done in 1 visit for $300, the same price. Which would you prefer? I think most patients would choose paying $300 to do it 1 time and take away no tooth structure versus 2 visits and take away all your tooth structure. And now if it's done by that dentist in that 1 visit of less than 2 hours, they're making the full $300 in less than 2 hours versus half of that amount in 2 visits. So it would benefit the dentist to understand how to do biomimetic reconstructions of teeth.
Fantastic. Fantastic. So let me ask you a separate question along the same lines. Is there principles that biomimetics would apply to, or materials that biomimetics would apply to in, let's say, orthodontic care or in periodontal care, things like that?
Yeah, there's some things. For example, you're talking about conserving tooth structure when you're doing smile makeovers. Well, if your teeth are not in the proper position, you wind up taking away more tooth structure to build it back out to accommodate the malposition of your teeth. So a lot of times if someone's teeth are in a crowded position or malposition, I may choose to recommend Invisalign or some orthodontic procedure to get them into a better position, so you have a better occlusion and they're in a better position, so the end result could be more conservative. So that's how orthodontics comes into play with biomimetic dentistry. Periodontics, a lot of times we're able to do what's called gingival margin elevation. It's a procedure where in some cases, we can avoid the periodontal surgery, the crown lengthening, and actually rebuild those deeper cavities that go down deeper beneath the gums and build it back in a predictable way without putting you through the surgery. And that saves money, that saves tooth structure and saves bone, and it's healthier in that way if you could do it. Not every time it could be done, and there are times obviously where periodontal surgeries are indicated. But if I could preserve the bone and structures around the tooth and predictably build back the deeper margins of the teeth, it's healthier and easier to put the final restoration on, or I can just build it back directly and I create a full restoration. I've done restorations where I've, again, preserved the nerve, avoid the root canal, avoid the crown lengthening, avoid the crown, and in 2 hours rebuild that whole tooth, and you save all tooth structure, which is the goal.
So thank you. Any home care things that you feel that patients would benefit from that would complement the work that you do?
Well, I don't. I try not to advocate too many things unless I really believe in things. And I'm on this conversation with you because I obviously I'm a huge fan of Periactive, which is the rinse that you developed, because this is how we connected. I spoke to you after going through the results of seeing the rinse firsthand and doing my own clinical trials. And I was a huge fan of seeing that. That's how we connected, because I love it. And it's rare that I see something that I could see the effects, I could see the results, and I hear from patients, how it's helping them. There was a short period of time when I guess for whatever reason the product disappeared for a little while and we couldn't get it. And my patients, I didn't realize how important it was and how these patients were loving it until it was gone, because they all were saying, I can't find anything else as good. This is the only thing that's working for me. This helped me so much. And I can see the healing that takes place when they do use it. So that, to me, talking about, biomimetic procedures, this is helping to rebuild, the health of the surrounding structures, which is the goal of this type of effort. I'm trying to rebuild a tooth structure, and I'm trying to use products like yours to help, rebuild and get the surrounding structures healthy.
Mark, this has been actually very, very fascinating, and I've learned quite a lot of things that I didn't know before as well. So first of all, thank you. Thank you for your time. Thank you for your expertise. And it's such a nice time on this podcast, and I think our listeners did as well, that we may be getting a lot of feedback requesting a second session. So
I'm happy to do that. Thanks.
anyway, so thank you very, very much.
Thank you for tuning in to another enlightening episode of the Confident Smile Podcast. Remember, your smile is your greatest asset, and taking care of your dental health is key to showcasing it with confidence. Stay tuned for more valuable insights, tips, and expert advice to help you achieve and maintain a healthy and beautiful smile. Until next time, keep smiling with confidence.